Good evening. Thank you for joining us. A shift in strategy from the Ford government after facing the fire over its color-coded COVID-19 framework. The thresholds for each of the levels or zones have now been lowered, so more regions end up with more restrictions. All of it stopping short of a lockdown despite some grim projections for the weeks to come. More areas in the GTHA will be seeing red after the province's move to better control COVID. A sharp contrast from the messages that had been delivered in recent weeks.
We're staring down the barrel of another lockdown. And I will not hesitate for a second if we have to go further.
Halton Region, York Region, and Hamilton will be joining Toronto and Peel in the red, or control zone. That means a few more restrictions.
If you live in a red control region, please only leave the house for essential purposes.
New models and projections were presented on Thursday, showing that daily COVID case counts could reach 6,500 per day by mid-December. Ford said that the difference between that and the projections from less than 2 weeks ago, which showed cases reaching 1,200, forced him to react.
I can reassure you that if I saw 6,500 cases 10 days ago, I wouldn't be out here today saying what we're saying.
Despite the change, the chief medical officer of health said more needs to be done to determine what a full lockdown would actually consist of, should it reach that point.
Does it consist of closing certain aspects, all aspects? Does it include closing schools, yes or no? What do you do with long-term care visitation? And you want to make sure there's the right balance. So therefore, we're taking our issues to the public health measures table, and then we'll bring back recommendations to the minister and to the premier next week.
A move the premier says he would now support once it's figured out, despite his recent resistance in an effort to spare the economy.
When I get the green light, and Dr. Williams says the tables come back and they want a lockdown, I will lock down quicker than you can blink your eyes.
Now, it was clear that Ford was feeling the pressure today. He was asked why he's not referencing the number of deaths going up. He repeatedly said that all of this is weighing on him. Of note, earlier today, the Registered Nurses of Ontario added their voice to the many calling for a lockdown of sorts. In addition, they're calling for the funding needed to support long-term care as the numbers at facilities rise rapidly again. Let's look at those. This all comes as the province reports its third highest daily total of new coronavirus cases. 1,396 new infections are being confirmed, which bumps the 7-day average to a new high. 19 additional people have died. 10 of them were in long-term care home residents. The number of patients in hospital has surpassed 450, with 106 in intensive care. Now, once again, 84% of today's new infections are coming from the Greater Toronto and Hamilton area, led by Toronto and Peel, which are both adding 440 additional cases. And it's that kind of explosive growth that's sparking comparisons to what's happening in other parts of the world.